Well, one of the main challenges facing China's healthcare system is the lack of doctors. In 2015, there were 2.2 doctors for every 1,000 people. In comparison, the US had 2.6 doctors for the same amount of people in 2014. Well, now the government wants to push that number to 2.5 doctors by 2020. It's also trying to upgrade the healthcare talent pool by raising the number of general practitioners. It's targeting at least 2 family doctors per 10,000 families by 2020, up from 1.4 in 2015. Well, for more on this topic, I talked to William Hsiao from Harvard University's T.H. Chan School of Public Health. He's a professor in the school's Department of Health Policy. I asked about his views on how to better manage the doctor appraisal system.
I think you have to, actually train the doctors in more formally and give them a cert, which China is doing by establishing formal residency programs. But to me, it's equally important. China only promotes the doctors up to the rank by asking them to publish research reports. That's wrong. There are many doctors who are excellent patient-caring doctors who know how to heal the patients, but not get into research. China has to develop a parallel track promoting doctors up the rank of senior physicians, deputy chiefs, chief of services, to these higher ranks based on how well they can actually heal the patients and maintain the current system just for the ones who are doing research.
And let's talk about access to care. How much does the access and quality of care range, say, in urban versus rural areas, and even when it comes to Eastern and Western China?
Certainly there's a big difference in the access. There is a difficult access to the level 3 hospitals and outpatient clinics, as I said. But there is no problem access to level 1 and level 2 facilities. Why is that? That's because patients do not know who is really a good doctor, and then they go by the physician's rank. And as I just said, China ranked the patients based on their research output. Consequently, they were congregated in these level 3 tertiary hospitals. China has fundamentally changed that.
Now let's also look at the two-child policy that China has. Just how prepared is the country and its family doctors for this growing population?
Definitely China has a shortage of pediatricians. And with the change in the one-child policy, and also because of one-child policy, parents worry about their single child very much. Whenever the child has a minor illness, they rush the child to the most sophisticated pediatric hospital outpatient clinics. And if they have even a modest illness, they will hospitalize in the pediatric wards. And that is the psychology produced by the one-child policy. So China definitely have a shortage of pediatricians and pediatric hospitals to meet what the people demand. How much can a family physician take care of that? I would say then the family physician have to be able to build up their reputation that they really can give good care to the children.
So as we look at some of the issues that China's healthcare is going through and some of the reforms, I mean, there's some issues with things like scalpers for targeting people who can't get the appointments that they want. When it comes to the most important health reforms that you think would make the biggest difference to everyday Chinese, what do you think that would be?
That would be by using the cell phone to allow people to make appointments and to pay for their services. That is already spreading in China. Patients can make appointments with doctors just by using their mobile phone. And they can also pay each services by using the QR card. And that needs to be spread much more widely. That, in my view, the waiting time, the need to make appointments and the use of scalpers, that phenomenon would be largely disappearing in a year or two.